ये क्या कचरा है, साफ कर इसको।
थोड़ी देर में करता हूँ।
मैं ही कर देती हूँ।
OCD है इसको। I have often heard people use the term obsessive compulsive disorders or OCDs very loosely. It is important for everybody to understand that OCDs are essentially of two components, obsessions and compulsions. Obsessions are those unwanted, intrusive and distressing thoughts that come to a person's mind, whereas compulsions are the actions that follow these thoughts to relieve them from the distress. However, it is important to understand that we should not stereotype people who want neat and clean houses or surroundings as those suffering from obsessive compulsive disorders. What this does is, those people who have different types of OCDs fail to accept their own diagnosis. They are so unaware that these distressing thoughts or compulsions need attention that they fail to seek help. This leads to them having a very distressful and a stressful life, which has impact over their mental and physical health. There are different types of OCDs. The first being contamination. Here, the person feels that he is infected with germs and wishes to wash his hands repeatedly to rid him of the distress caused by this thought. Second is checking, where the person feels that he has forgotten to lock the door or to switch off the lights. For this, he keeps on repeatedly checking whether he has done the same. This helps him to relieve the distress. Third, OCD of symmetry. Here, the patient has a distressful thought wherein he wants everything to be symmetrical, be it his office table or his closet. For this, he keeps repeatedly arranging the stuff on his table or in the closet. This helps him to relieve the distress. Fourth, taboo thoughts. Here, the patient gets unacceptable sexual thoughts about gods or other such taboo thoughts. For this, the patient feels very ashamed and does not know how to rid himself of the distress. The fifth type of OCD is hoarding disorder. Even though this has been declassified as an OCD symptom, people with hoarding disorder often have distressing thoughts that they will run out of substances. For this, they tend to hold large amount of these substances. This helps to rid them of the distress of the thought that what if I run out of those substances. Now that we know the difference between being clean and actual diagnosis of OCD, I want you to be kind towards your mind.